बिस्मिल्लाहिर्रहमानिर्रहीम अस्सलाम वालेकुम। मैं हूं नादिया बशीर, आपकी मेजबान FM 102.2 Riphah Rehab Show से। Today we'll be discussing echolalia to meaningful speech, and we'll be exploring how important it is in terms of children with autism and how we can use the Gestalt language processing in chunks or scripts rather than a single word. It highlights how echolalia is not meaningless but a crucial step towards communication. The show is going to be focusing on how therapists and caregivers can support children in turning these scripts into flexible, meaningful speech. We have with us today in our studio Sarah Bloom. She's joining us all the way from England, and she has over 20 years of experience working with children and adults with additional needs across a variety of settings. Her journey began in 2006 with working as a volunteer in orphanage home in Mexico. Since 2008, she has worked in special education school, and she has supported children with complex needs, including those with autism requiring high levels of care alongside her professional commitments. So, alongside her professional work, she has also done her BA in Spanish and French. Before beginning her speech and language pathology training at City University of London in 2016, she completed an intensive master's program with her final research project focusing on background, noise levels, and multilingual speakers. Following qualification, Sarah worked for 2 years in specialist autism school to further strengthen her clinical expertise. During this time, she collaborated closely with multidisciplinary teams, including occupational therapists, behavioral specialists, psychologists, and fellow speech and language pathologists. She has gained valuable insight into the integrated care approach, and she has also gaining international experience through volunteering at a speech clinics in Ghana. Her career has since included roles across mainstream schools in London, including additional resource provisions as well as locum work within the NHS assessing children in educational settings. Currently, she's working as a part-time in a private schools that supports children with a range of needs, including low-functioning autism. Alongside her role in an NHS specialist clinic, she's also working with children with cleft palate and speech sound disorders. Let's welcome her to our show, and let's formally begin the show also. Hi, Sarah. Thank you so much for joining us. Um,
Hello. Hi. Thanks for having me. Uh,
so, let's formally begin the show. And my first question to you would be, what is Gestalt language processing, and how is it seen, within the parameter of autistic children, and how can we briefly explain that how it relates to their different stages of natural language acquisition framework?
yeah, good question. Gestalt language processing is a phrase that's being thrown around quite a lot at the moment. Everyone's talking about it online. I mean, the phrase Gestalt was proposed years ago, back in 1977, by a lady called Anne M. Peters, I think it was, who was a linguist, and she proposed that there were learners that learn words like in single words and in Gestalt phrases, but she termed it chunks. So I can give you an example of that. I have a cousin actually who's autistic, and when he was little, he would use a chunk of a phrase. For example, he would say what you want for to mean I want something. So every time he wanted like Cheerios cereal or something like that, he would go, "What you want?" And so that was the chunk phrase that he'd associated with that context. Um, so so basically, this term just Gestalt has been around for ages. And even when I first started working in SEN schools 20 years ago, just as a like support worker and carer, with people with autism, we would talk back then about how they're acquiring or learning the phrases, listening to the intonation and the pattern and stress of the phrase alongside the word. So, for example, if I said hello and then said hello, for them that would be completely different meaning because they're hearing the pattern combined with the word. Um, so we would talk about that years and years ago, but in 2012 that became Marge Blanc wrote a paper that defined the Gestalt Language Processor, GLP, language processor, as opposed to just language processing. So and this was a more specific framework. But this was also inspired by works in 1982 by Barry Prisant, 1983, and he also coined the term Gestalt processing. Um, and so within Marge Blanc's paper in 2012, she identified that there are 6 stages in language development. And this is known as the natural language acquisition framework. So she basically said that these stages were one, echolalia, which is the repeating of phrases, and that can be immediately or later. She proposed the second stage being mitigation, so where those parts of the repetition are broken up and mixed together. And then stage 3, single word phrases. And then the early grammar started developing between the stages of 4 to 6 and becoming more fluent by the 6th stage. So that's sort of an overview um, of what it is.
Okay, so how is it, how is the Gestalt language development different from the typical language development? How is that different?
Yeah, good question. So if we think about Piaget, I'm not sure who exactly you're studying in the universities there, but in England we would look at Piaget's theory, and he would talk about how the actions, doing things, and also seeing the actions support language learning. So, for example, if a child claps and then says, and then hears the word clap, they're going to learn that action is associated and mapped onto that word. So we would typically learn words independently as well as contextually, and develop those patterns, working out when they're used and when they're not. So whereas with GLP, with the Gestalt language processing, they're not doing this. So as I said, they would be saying chunks of language. So like with the what you want example that I gave, or for example, as you're going out the door, you might say, let's go. So they might learn let's go, or for example, sometimes you might say, "Oh, how are you?" And I've had children repeat back exactly that phrase. So you say, "How are you?" and they go, "How are you?" So they're mimicking exactly the phrase that you say. I'm working with a little girl at the moment, and she'll say to me, so she would repeat, if I say, "Hello, Sarah," she would go, "Hello, Sarah." But I had to say the phrase that I wanted her to say in order for her to say it. So with these chunks, they are learning them in context. So for example, with that example of my cousin going up asking for the cereal, um, he was learning that was said in that context. So there is a meaning there. It's a contextual learning, and that was what Barry present started to recognize, that there's meaning in this repetition, he encouraged that we needed to accept it and not try and fix the echolalia, but support the learning, the sort of treating it in a naturalistic way, basically. Um, and so Marge Blanc compares this Gestalt language processing to analytic processors. So she would say that, we're hearing those chunks as a whole, and then from that, we're following the 6 stages of acquisition, as opposed to the Piaget's model of learning the words in isolation. So there is actually some conflict in the evidence of, we are taught to model language all the time. You pick something up, you say what it is. Whereas in uh, the GLP framework, it says not until stage 3 to start modeling single sounds, but that would go against our knowledge as clinicians. So there are certain things that you have to be a bit careful and use the triangle of evidence to think about what works for your child or the child that you have. Um, and so yeah, so another example as well. Um, so you'll see that in typical developing children, by 2 years, they'll put two words together. So they're starting to break up the language and analyze it, saying, mummy go, or more juice, or dog bark. So they've worked out how to break the language apart and put it together. They're starting to. Whereas that stage, according to the GLP, it doesn't come until the early grammar, so stage 4. So the GLP framework is done in stages, but we look at language by age. The typical developing, we're usually referring to their age. And yeah, and another example, so in Brown's morphemes, we use as a reference for specific structures in the word. We'll see that the ED endings arriving by 4 years. But again, this is happening at stage 4 in the framework, so it doesn't matter. Her framework is looking at stages, whereas this is looking at ages. Yeah, that's
What are
yeah.
the early signs that you would, look out for, that we should look out for that a child may be a Gestalt language processor, and how do we identify them in the during our assessment process in the clinic?
Yeah, good question. So again, this is something that it within the Marge Blanc's framework. It isn't strongly evidenced in how somebody could be a GLPer,
Okay.
as what people are terming now. Um, because it lists, someone with echolalia, it lists someone who's a minimal speaker, someone who uses jargon or unintelligible speech. And so really in clinic, we have children that come in with all of those
Mhm.
traits. So the definitions are a little bit flimsy, but it doesn't mean that they aren't there or that they're not using the Gestalt language processing. And I don't think anyone's disputing that that exists. And there is a strong there are strong um, presentations that show that children are using Gestalt phrases, for example, the echolalia. And with that intonation, you can hear sometimes when it's unintelligible, if you say, "Oh, come and help me with the with tidying," you might hear a so there's an intonation copying, but there isn't meaning there. So there are lots of things that I don't think anyone's disputing. But in terms of having the clear categories, and evidenced categories to use for formal assessment isn't quite there. At least we don't acknowledge it fully in the UK for that aspect. But yeah, so I think that it is, again, it's important to use that triangle of, where you're looking at the evidence, and you're basing your experience and observations of your child. And yeah, and also I don't think I mentioned with the echolalia, so that's the repeating of phrases, it can be immediate. So it could be you're saying something and they repeating straight after, or it could be delayed. So it could be repeating, entire scripts of a TV show that they've seen 2 days ago or a week ago, or repeating songs. It doesn't have to be just the language in the moment. So we call that either immediate or delayed echolalia. Um, but I mean, and also what isn't that clear in the framework is that you can be both. So that doesn't help either. You can, be I'm even working with a little boy that I'm sure is both because he'll do the echolalia and the repetitions, but he's also fabulous at breaking down. He understands the individual meanings of words. So he'll point to, a verb and it will say kick and he'll say kick and do the action. So I see it in both in him, but I do also see other children that do seem to be using more Gestalt language processing and others that are being more analytic. So it's again, not only is it difficult to categorize, but it's a spectrum and you can be in and anywhere on it and apparently amongst any of the places on it. So that's again why it's difficult to pin down. Yeah.
Okay. So, I mean, Sarah, would you like to tell me that, some of the patients' parents have turned into our clinics. They're worried that their child is, has echolalia. So do you think how worried should we be about the echolalia, or should we stop it, or is it actually helpful for the language? What would you recommend to the parents?
Yeah, definitely don't stop it. So years ago, many years ago, it was looked at something to fix, which is what that Barry Present started to change, and he moved
Uh-huh.
away from that, starting to, encourage and nurture this way of using language. We don't need to be worried. We want to encourage the echolalia. We know that is definitely evidence that repetition of language in itself is supported, shown to support language acquisition, just repetition by itself. So we'd always talk about this when I worked at in the school for children with autism. We would also always talk about how, regardless of anything else, repetition is evidence to help and using the language. So definitely don't stop it. And so yeah, so it was back in 1982 with Barry Present, who said who encouraged treating the echolalia as a meaningful communication. And that was a good example, I think, I used right at the beginning with my cousin who said what you want instead of I want this. It was still meaningful, correct context, correct topic. Everything was correct except the pronouns and the grammar of the phrase. So yeah, so and even we talk about, we should assume there's meaning, even if we're not understanding it. We might not know what they're meaning, but we it's important to encourage it and assume that there is meaning there. So for example, even if they said something like, this is maybe a silly example, but to infinity and beyond, you might want to respond saying, let's go to support the context,
Exactly.
encourage it. And it can be quite fun. Yeah.
How involved do you think a parent should be in terms of understanding their child's communication style?
Yeah. I think it's I think it's really helpful to one, have them observe. So if you want them, to do something with you, it's so important to model it to them. Because I've met countless parents that are, fed up of just being told do this and that, but not really shown. So I think have them see as many times as possible. We take for granted what we learn, and how to be therapists, and then we just expect parents to be therapists, forgetting, how long we've sat with reflection and supervision. I think it's important to listen to them, and you really want to know what they feel specifically, and if you're not connecting with them, I find that they won't follow through with any advice if you're not going to be present and really listen. You have to show them that you're there, otherwise they're not going to be there. either, that they're not going to invest in what you're saying. And I think, if you have time and capacity, observing the parents interact with their children and offering them feedback on how to engage with their child. And if you have the time, the resources, the permission, you could do videos of how they're interacting with their child and show them back at later dates and see if you can offer goals, mini goals for them to achieve throughout the sessions. And I think we'll talk about it in a bit, but you want them to start to be able to follow the child's lead. Yeah.
So, what therapy approaches do you think works best for children who are Gestalt language processors? And how do you think we should move them on with developing their language?
Yeah, that's a good question as well. I think well, there's something called intensive interaction, which this would be really useful for those that might appear to be averse to interacting, or you might not be getting much out of them. And this is a great method for encouraging enjoyment of interaction generally, and just encouraging them to share a space with you. So depending on the severity, but that's a nice place to start with those that are really averse from wanting to communicate. And this is specifically for those with autism, really, really is supportive for that low functioning autism. And then also, and so this is rooted in copying. So copying is one of the most intense forms of communicating, and that's really rooted in that intensive interaction. And it can also provide reassurance for those with anxiety because it creates a predictability in the environment. What they do, you do, and nothing else happens. It's very, very relaxing for them. They feel in control. And it creates a sort of sense of a safe space. But after that phase, if there is a ability for them to sort of share a space and play, there's sort of maybe there's role playing with toys and things like that, and they are able to play with their toys and allow you to sit alongside them, then we really want to encourage that child-led play. And so it kind of leads on from that in a way, because you might be copying sometimes, but you're letting them lead. So it's about letting them lead. So it can be quite nice to learn intensive interaction before, because it's the ultimate letting someone lead situation. So it really helps you get used to doing that. It's quite hard to do, I think. I mean, I'm not a parent, but I imagine as a parent, it's especially hard to do if you're constantly used to giving instructions and, you're offering the control, then you really want to be able to create those spaces, even if it's 10 minutes a day, 15 minutes a day, where you can switch off from parent mode and become the play buddy. And it can be enjoyable and fun to let go and not feel you have to control every moment. I mean, as long as they're safe, does it matter if something's being thrown over too far away, or so it's about trying to step back with our instructions. And then within that play you want to offer relevant phrases. So for example, if the child is using that Gestalt way of speaking, you want to encourage those Gestalts that are popular, common, and contextually relevant. So, for example, if they're moving a train along, you've probably seen the ones where they'll go, mind the gap. So we have that a lot in London, the mind the gap. Or you might want to say, let's go. So you'll practice phrases that are relevant to that game. And when they do use, this can be inside the game or outside, but when they are muddling those pronouns, or for example, saying what you want, or what do you want for I want Cheerios, or whatever it is, you want to repeat back the phrase, but in the way that you want them to say it. So if they say, what do you want? You say, I want Cheerios. You won't say, oh, you want da 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 da. You'll repeat back for them the way it's meant to be for them in that context. However, at the point where they're developing language more and moving away from that those Gestalt phrases and starting to mitigate and moving phrases together, you can try and amplify their language and model, variations of the phrases. So for example, you could do so even for the using the let's go, you can use it in one situation and then another. So hope I haven't made that confusing.
No, no, that's
Um,
very much clear.
yeah, and just one other example as well is because of the intonation, one thing we used to do years ago, we did it a lot, is you might say there's a child called Emily, you might say, oh, Emily is washing her hands, washing her hands, washing her hands. And so we do a lot of singing and sing-songy, and it adds to that sort of catchy sound, that when they're processing the intonation, it makes it much more interesting and catchy for them to latch onto, because they're hearing everything. So, like I said, if you say hello and then hello, that's completely could be completely different meaning for them. Yeah.
So, how much do you think, okay, so the question is that since we're in a multilingual setting in Pakistan, so how do you think the language exposure affects these children?
Yeah, it's a good question as well. We have it a lot. We have it a lot from parents that are multilingual or bilingual. We always say that learning multiple languages doesn't contribute to difficulties with language. There's no evidence for that. We don't we never say to anyone to not use a language. We always recommend that parents or guardians
Mm.
or whoever it is with the child, we always suggest that they use the language that they feel most confident in. And if that is two languages, then it's two languages. But we never discourage the language learning. I mean, theoretically, the child is acquiring more language patterns. And that suggests there could be a prolongation for a certain period of language acquisition. And I mean, I often see children that are learning English, but as a second language around maybe 4 years, 5 years. And sometimes there can be that retreat of quiet before they start to speak again. But later on, there's no evidence to say that it's impacting or hindering the language acquisition. There could be, I guess, with Gestalt speakers, the phase of the mitigation where they're swapping languages over, it could appear that it's less consistent. But if the observer speaks the same languages, it shouldn't pose any confusion if people are aware. So we would never say to discourage or not to speak different languages.
Okay.
Yeah.
Sarah, due to the shortage of time, I would love to have this conversation with you. It's very fruitful, very insightful. But due to the shortage of time, as we're moving towards the end of our program, what message would you like to give to our parents who are concerned that their child's speech and language development is being delayed? So, what tips would you like to give them?
Okay. I mean, first and foremost, if they feel there is, I mean, we talk about communication
Mhm,
differences in autism, but also there may be language difficulties, as well as differences.
mhm,
But if the parent does feel there are any, language difficulties or even social or communication, or accessing the curriculum, then I would recommend they try and seek a speech and language therapist to review their needs. Um, top tips would be encourage echolalia, have fun with it, play games to repeat their phrases, change them up, do songs, do whatever the child is interested, follow their lead, and however strict you are, try to find 10 minutes a day where you can sit on the floor
mhm.
with your child and let them lead you for 10 minutes, and just practice waiting, because I find sometimes I'll wait and then they will suddenly say something and I thought, oh, I'm glad I waited there. It's so I find it easy to jump in and say all of our thoughts, but they have a lot going on, and they often do need that time. So I would recommend offering them that wait time. You could practice little phrases throughout the day. So breakfast, lunch, and dinner, repeat the same Gestalt phrase, it could be time to eat, and you repeat that breakfast, lunch, and dinner. So you're using the same phrase in different settings, or let's go in the morning, let's go in the afternoon. Practice using the same phrases in different settings, but it can be very fun. Yeah,
Okay, thank you so much, Sarah, for joining us all the way
that's
from England
okay.
and taking your time out, especially after work. Thank you so much once
Oh,
again.
that's okay. Thank you. Thank you, Nadia. All right.
सामीन, आप सुन रहे थे हमारा स्पेशल शो। मैं उम्मीद करती हूँ कि ये शो आपके लिए काफ़ी नॉलेजेबल हो। अगले हफ्ते हम फिर मिलेंगे एक नए मेहमान के साथ, नए मौजू के साथ। तब तक मुझे इजाज़त दीजिए। अल्लाह आपका हामी और नासिर हो। अल्लाह हाफिज़।